He disputes
lying about it to this day. David Cowan, STV News, Dalkeith.
Parents have reacted with anger after a drug used for treating cystic fibrosis was turned down for use in Scotland. They believe Kalydeco, which is available in England, could protect their children from a life blighted by the disease and help them live well beyond what is currently expected. But the Scottish Medicines Consortium decided not to recommend the drug, arguing the cost of prescribing it outweighs its benefits. James Blake reports.
Kate Gordon was supposed to be at school today, but she's been rushed to hospital with a symptom of cystic fibrosis. Her parents had hoped a new drug would stop all this and transform her life. But today, the Scottish Medicines Consortium decided the drug, Kalydeco, won't now be available on the NHS in Scotland.
Personally, I feel bewildered, frustrated and absolutely let down by a process that we had complete faith in, a process that we thought would mirror the conclusions that were reached in England, Northern Ireland, France, Germany, United States. We were expecting that our daughter, who's currently in hospital with an exacerbation of her condition, cystic fibrosis, would be hopefully in a position to start this treatment very, very soon.
Kate Gordon is at York Hill getting emergency treatment for pneumonia. If she lived in England, she'd be taking Kalydeco by now, but not in Scotland. In fact, every new delay here puts her life in danger.
Kalydeco could replace this cocktail of drugs. It works for patients with a specific gene. That's 11% of the people with cystic fibrosis in Scotland.
We were involved in some of the trials of the drug at the Royal Brompton Hospital, and it had a very dramatic impact on patients' health. The primary outcome that they were looking for was improvement in the way the lungs work, and they improved very dramatically, but also patients experienced fewer admissions to hospital, they gained weight more readily, and they actually felt much better in themselves.
But at £200,000 for every patient every year, it's just too expensive in Scotland. And apparently the drug company didn't offer the discount they did in England. Instead, the Scottish Government is setting up a new fund for rare diseases.
Anyone, particularly children in the case of this drug, who could benefit from this drug can make an individual patient request. And what I'm doing today is announcing this extra £21 million to make sure that no individual patient request needs to be constrained by the lack of funding, to make sure people who need and would benefit from the drug, according to the clinicians, can get it.
But for families and campaigners, the new fund raises more questions. Who will decide which individual gets the drug? How long will the process take? And what happens to patients like Kate when the money runs out? James Blake, STV News, Glasgow.
4 men